What's up, guys? Welcome back to the channel. If you're new, my name is Ramiz. I'm a board certified internal medicine physician currently back in training in radiology. And today what I want to talk about is some of the changes happening to the United States medical education system, in particular, the discontinuation of the USMLE Step 2 clinical skills portion. Now, for those that may not be familiar with how the United States medical education system works, it goes a little bit like this. You take a whole bunch of prerequisites and you take an MCAT examination, and that's the first layer of filter, which prevents people from getting into medical school. And you take 4 years of undergrad during that time. Now, after those 4 years, you apply to get into medical school. Medical school is split into basically two parts you can think of. The first two parts are a whole bunch of desk learning and didactics, and that's the first 2 years of medical school. After the first 2 years of medical school, you take the next big filter, and that's USMLE Step 1. You take that examination, and honestly, there's too much weight put on USMLE Step 1. Depending on how well you do on that exam, usually determines what kind of specialty you're going to be training in. So higher scores in the USMLE Step 1 usually means more competitive specialties. After taking USMLE Step 1, you start doing the second portion of medical school. Medical school in total is 4 years, just like undergrad. The second portion of medical school is more clinical and more skill-based. During that time, you take the USMLE Step 2. That exam is split up into two parts. One part is a written portion that's about like 8 hours long, and the second portion is a clinical skills portion. Now, that portion, you go into a facility and you interact with trained actors that are there pretending to be various different types of patients with various different types of diagnoses and illnesses. You go into each room, you're timed, you meet the patient, you introduce yourself, you do a basic physical exam, you ask the right types of questions, you come out of the room, you make the diagnosis, and you start ordering the basic workup. And that's pretty much how it goes. Now, recently, they decided that the USMLE Step 1 was going to become pass-fail. That's fine. I think that's a great idea. I think you take USMLE Step 1 so early in your infancy, in your medical career, that you don't understand the magnitude of how important that test is, and way too much weight is put on the USMLE Step 1. That part, I think I agree with. Now, the part of discontinuation of the clinical skills portion of the USMLE Step 2, there's a lot of hype on the internet, and a lot of other medical students are happy. You know, in theory, sounds good. One less exam, you save some money, and one less exam for becoming a doctor. And right, sounds good. However, I have a different take on it. I took all the examinations. There's a USMLE Step 3 as well, Part 3, Step 3, whatever you want to call it. And that usually you take in your intern year of residency. So I'm done with all the steps. So I've been through the entire process. Now, the USMLE Step 2 clinical skills portion, a lot of the complaints that people have is that they feel very uncomfortable during that exam. You have these trained actors, you're stressed out. These actors are, pretending to be, children. Some of them are children, some of them are adults, and the whole experience feels unnatural, and a lot of people dislike the entire experience. And I understand that. It is a very uncomfortable experience. It's nerve-wracking. You spend a lot of money, you go to this facility, and overall, it's not the most fun thing. But when did you think that becoming a doctor and meeting actual patients was going to be straightforward and fun? Now, if you are too stressed out or you feel too uncomfortable with these actors that are pretending to be patients, how are you going to feel around the actual patients? And one thing that I think that people fail to realize is the importance of experience. Take it from me. I used to be an attending, and now I'm a resident again. The only thing that separates my superiors, like my attending, from a resident like me is experience. So you have to gain that experience any way possible. This Step 2 CS clinical skills portion was one of the first times when you're going to be in a situation where it's you and the patient. You know that you're being watched. You know that everything you do is being critiqued and judged, and that's exactly how it is in real life. You're going to see patients in real life. Sometimes family members are going to be there with the patients. You're going to be judged. Nurses are going to be there. Other staff is going to be there. And you as the physician, whether you like it or not, you're going to be judged in everything that you do. Okay? So you have to go through this feeling of uncomfortable, like this uncomfortable feeling, this anxiety. You have to go through it and still keep a cool head. You have to be able to think on the fly and come up with the right decision, which is best for your patient. And the only way, honestly, that you're going to do that is through experience. So I think going through this exam, you're in a controlled environment. These are actors, these are not real patients. And you're being watched. That anxiety, going through it, it's going to kind of be your first time. And getting your first time out there in a situation like that is better than having your first time in front of actual patients. Now, overall, the exam wasn't difficult either. As long as you're a decent communicator and a decent physician, majority of people pass the exam anyway. So it wasn't even the stress of that. It was just the entire feeling. I agree, it is an uncomfortable feeling. You have adults that are acting as children. You're trying to make these diagnoses. You're trying to get things right. You're trying to stay within a time limit. But I think that pressure was needed, because then after that, you start seeing real patients. Then you become an intern. Then you are the actual resident. You're the actual doctor who's responsible for these patients. And so I think this is just one less weapon to add into your arsenal. So this is one less experience that you just are not going to get anymore. So I really feel like overall, I think it's a detriment. I think it was a good experience. It was stressful, but it was a good experience. Patients, when you're going to meet them, you're not going to always feel so comfortable. If someone goes into cardiac arrest in front of you, you're not going to feel comfortable. When someone has difficulty breathing, you're not going to feel comfortable. But you have to learn. Part of being a doctor, you have to learn how to get through and be able to think in these situations where you're not comfortable. And that's why residency is so long. Take it from me, I don't want residency to be so long, but residency is really long because honestly, you have to gain experience, and that's it. And experience takes time. So that's really why residency is so long, is because you just need to have time to build up these experiences, and that's what makes you a great physician. So residency is a time of organized chaos. You're still being overlooked by attendings. Once you're an attending yourself, that's it. There's no more overhead. Now it's just you and the patient, and if you make a mistake, that can cost someone their life, and you definitely don't want that situation. So those are my thoughts. I mean, I get it. You have to take one less exam, but I really feel like it's a detriment overall in the long run for everyone who's going into this profession. So those are my thoughts. Let me know your thoughts down below. Don't forget to like and subscribe. And if you're new to this channel, thank you for watching. And until next time.